Hello, I am Dr. Therese Macatula, and I am here to give a brief discussion on the basics of viral hepatitis. The objectives of my short talk are as follows: to give an overview of the different types of viral hepatitis, to discuss modes of transmission including perinatal and horizontal transmission and hepatitis B and C infections, and to show risk of chronicity for these diseases, and to give a review on interpretation of viral serologies. Just to review, hepatitis means inflammation of the liver. Viral hepatitis pertains to liver inflammation caused by virus. Symptoms of viral hepatitis are not specific to the viral agent, and thus, symptoms cannot be used to differentiate between the viral hepatitis. Acute viral hepatitis, meaning viral infection for less than 6 months, may present as non-specific flu-like symptoms such as fever, anorexia, generalized body malaise, followed by jaundice. Chronic viral hepatitis B or C infection, meaning viral infection for more than 6 months, will usually not manifest as any symptoms until late in the course when cirrhosis sets in. Thus, the key to clinching the diagnosis of viral hepatitis is the correct interpretation of viral serologies. These are the more common and clinically relevant viral hepatitis. Viral hepatitis A and E are very similar in that they are transmitted via fecal-oral route and that they almost never progress to chronicity, except in the immunocompromised host. Hepatitis B and C are both transmitted percutaneously or permucosally via blood and other body fluids. Both can become chronic diseases and lead to development of cirrhosis and cancer. Prevention is possible in hepatitis A and B through vaccines. Hepatitis D is a virus entirely dependent on hepatitis B. Thus, immunization of viral hepatitis B means protection against hepatitis D as well. Now, there are two types of transmission, vertical and horizontal. Vertical transmission of hepatitis B is the passage of viral hepatitis from the infected mother to the newborn child during that period immediately before and after birth. In this perinatal transmission, there is a 90% chance that the newborn will develop chronic illness. Now, in a hyperendemic nation such as the Philippines, where prevalence of hepatitis B is 16.7%, this is the most common way of transmitting hepatitis B. Horizontal transmission is the spread of an infectious agent from one individual to another through contact with blood and body fluids. In children, there is a 50-50% chance that they develop chronic disease. In adult transmission, the chance of developing a chronic illness is 5% or less. Again, this slide emphasizes that hepatitis B can develop into a chronic illness. In perinatal transmission, at least 90% of newborns will develop chronic hepatitis B. Horizontal transmission in adults confers chronic infection in only 5%. Now, in hepatitis C, infection via vertical transmission only occurs in 3 to 10%. Unlike hepatitis B, horizontal transmission is the more common route of transmission in hepatitis C. In the Philippines, about 2% of the population is infected with hepatitis C. Like hepatitis B, hepatitis C can develop into chronicity. However, different from hepatitis B, chronicity in hepatitis C develops in majority of the infected patients regardless of age. Now let's review how to interpret viral serologies. As we mentioned earlier, correctly diagnosing viral hepatitis entails correctly interpreting the hepatitis profile. For hepatitis A, we have serum antibodies to hepatitis A. Antibodies to hepatitis A or anti-HAV of the IgM type can be detected during acute illness when serum aminotransferase activity is elevated. Anti-HAV IgM may persist for several months in the serum. During convalescence, however, anti-HAV of the IgG class becomes the predominant antibody. Thus, the diagnosis of hepatitis A is made during acute illness by demonstrating anti-HAV IgM, and after the acute illness, anti-HAV of the IgG class remains detectable indefinitely. Anti-HAV IgG may also be present in patients who have had their hepatitis A vaccination. Its presence accounts for the protection against HAV infection. For hepatitis C, we initially request for antibody to hepatitis C. Its presence denotes exposure to the virus but does not necessarily mean current active infection. HCV RNA is the most sensitive indicator of HCV infection. It can become detectable within a few days of exposure to HCV, well before the appearance of anti-HCV, and tends to persist for the duration of the hepatitis C infection. For hepatitis B, there are a lot more in the serology that we need to interpret. HBsAg or surface antigen determines infectivity. Positive HBsAg means the patient has hepatitis B infection. Anti-HBs pertains to immunity, whether from a resolved infection or vaccination. Anti-HBc or core antibody pertains to exposure to hepatitis B infection. Predominance of the IgM type means acute or recent infection. Predominance of the IgG type points to a historical exposure leading to either a resolved infection or a current occult or overt infection. HBeAg or envelope antigen appears during infection and pertains to infectivity of high replication. Having antibody to the envelope antigen may indicate low replication or the presence of a pre-core mutant. HBV DNA is used to quantify viral load of the infected patient. HBsAg, HBe antigen, anti-HBe, HBV DNA with the ALT all taken together determine the activity of the virus immune system or phase of the disease. So just to elucidate, in acute infection, HBsAg is present only until 6 months. It is initially accompanied by envelope antigen and the IgM core antibody. Within 6 months, resolution of the infection would mean loss of the surface antigen and appearance of the surface antibody, conversion of the IgM core to IgG core antibody, and conversion of the envelope antigen to envelope antibody. After 6 months, the presence of the surface antigen and absence of the surface antibody would now mean that the infection is chronic. Here, presence of the envelope antigen may be longer before converting to envelope antibody. Here are practice sets for review. I have a table here that will further elucidate serologic interpretation. This includes serology for hepatitis A, B, and C. In the first set, we see positive HBs antigen, meaning there is current hepatitis B infection, and the presence of IgM type of core antibody suggests that the infection is acute. With detectable viral load, this is interpreted as acute hepatitis B infection. In the next set, we have hepatitis B infection, but more of the chronic type, since the core antibody is of the IgG type. This is chronic hepatitis B infection. In the third set, we have no active infection, but an exposure to hepatitis B that has developed immunity. So this is resolved hepatitis B infection. In contrast to the previous set, this next one has no infection, no exposure, but only protection. Therefore, this is immunity to hepatitis B from vaccination. Now, in the last number for this slide, we have positive anti-HAV of the IgM type, meaning acute hepatitis A infection, on top of a chronic hepatitis B infection signified by positive HBsAg and anti-HBc IgG type. Next, We have acute hepatitis A infection, like in the previous slide, but also acute hepatitis B infection, signified by positive HBsAg and positive anti-HBC of the IgM type. Next set, we see that the predominant HAV antibody is of the IgG type. This means either immunity via vaccination or through resolved infection. The third one shows positive antibody to HCV without detectable viral load. This means exposure to hepatitis C without necessarily having active infection. In contrast to the previous set, the next set shows exposure to hepatitis C and also carries with it detectable viral load. Therefore, this is active hepatitis C infection. Now, the last one for this set shows acute hepatitis B infection, meaning HBsAg and anti-HBC IgM positive with concomitant HCV infection as in the previous set. So this slide summarizes our talk. So to recap, hepatitis A and E are transmitted via the fecal-oral route and do not usually cause chronic disease unless the patient is immunocompromised. Hepatitis B and C are transmitted through blood and body fluids and can become chronic. Development into a chronic disease is the rule in hepatitis C, while in hepatitis B, chronicity depends on the age at which the patient is infected. Vertical transmission is more common in chronic hepatitis B in hyperendemic nations like the Philippines, but horizontal transmission is more usual for chronic hepatitis C. Diagnosis is made based on proper interpretation of hepatitis serologies. And so in this lecturette, we have successfully discussed these objectives. Thank you very much.